Ku BBS Terefayina yaffe y'Obwakabaka bwa Buganda kwoli nkwaniriza ssebo ne nnyabo weebale kugyeekuumirako omusajja wa Kabaka abiri mu Yematovu Munnakalungu Munnabuttu nzikalidde ne Gombe Medical Services Hospital abasangibwa wano ku Balintuma Road. Gombe Medical Services Hospital beewaayo okutuwa abasawo abakugu, okutuwa abajjanjabi, okutuwa abasomesa n'ebyabulamu. Pulogulaamu eno ebeerawo buli lwa Sande essaawa 12:30 ez'akawungeezi wano ku BBS Terefayina. Olunaku olwaleero ndina omukugu Profesa Dr. mukugu mu ndwadde ez'ekiwanga. Tusumbuyibwa ebintu bingi matu, nnyindo, mimiro, naye musabye ne leero abeeko kyagattako. Era nga kye musaba olwaleero ayogere nnyo ku kumira, swallowing. Good evening.
Good evening to you too.
I understand you are a specialist in ear and nose throat, including the throat. It's part of that. People have got different challenges, difficulties about swallowing. We chew, we eat, at the end of the exercise we have to swallow. Now, what is the difference between swallowing in difficulty and swallowing with pain?
Good evening, people. Today this is a very important topic, and talking about the process of swallowing. We must recognize that in the process of swallowing we have 3 normal phases. That process is starting in the oral cavity. That means we have an oral phase. We have also an oropharyngeal phase, which is the throat part of our body. In the throat, it's passing the oropharyngeal phase of the swallowing. While we have another structure which is called esophagus, coming from the throat up to the stomach, to be talking in a popular language. We must recognize the third part of the phases in the swallowing, normal swallowing. But the differences in between that's pain in swallowing and difficulty in swallowing, there is no differences. Because you can never recognize it is also including the pain to swallow is also including in one of the difficulty in swallowing. It is true. Some people are having many symptoms, can be complaining about many symptoms, and all of them are including in the difficulty in swallowing. One of the most important symptoms is that one exactly, the pain in the swallowing process can be also being referred by our population like pain in swallowing. But some of them are describing it like dryness sensation to swallow. It is another common symptom in that. But can also be referred like the one of the commonest symptoms is when the food is going down through the wrong pipe. This is another kind of difficulty in swallowing also. All of that symptoms are included in the terminology of dysphagia. And ENT surgeon, we know how to treat it because we are the one who's are in charge of the oral cavity, also oropharyngeal region, and then we are in the initiating process of our normal swallowing.
Ali ku BBS Terefayina, Gombe Medical Services Hospital, yempadde Dr. Professor Lydia Lonza. Mukugu mu ndwadde ez'ekiwanga. Omumiro guno nagwo kitundu ku ndwadde ez'ekiwanga. Kaakati nno byadde tugamba nange byentegeddeko. Nankubadde bya lusawo nnyo. Nti okumira kulimu ebitundu 3. Obuzibu mu kumira ekisookera ddala. Bw'obaako oba kyolidde. Bwe kiba wano ng'okyagaaya wano tonatandika na kumira. Ekyo nakyo kitundu ku ekyo ekigenda okukolebwa. Kaakati ate ne mu kumira kwennyini ekimiro kino esophagus ekimiro kino era nakyo kitundu mu kumira. Kitegeeza nti okumira kugendera mu feezi ezo 3. Naye naga nti enjawulo wakati w'okuwulira obuzibu ng'omira oba n'okuwulira obulumi, byonna era bizibu, tibiina nnyo njawulo, naye obulumi bujja nnyo singa oba omira ate emmere n'egenda gyetalina kugenda. Oluusi nga bwe tugaa nti egenze mu kamira akatono, awo tabbu ebezze. Naye nga obuzibu obwo buggwaawo era bujjanjabwa wano ku Gombe Medical Services Hospital nga ye omukugu mu kujjanjaba n'okulongoosa agambye nti obuzibu obwo busobolera ddala okuggwaawo. Professor, what are the common causes of painful swallowing?
The commonest causes of difficulty in swallowing, we have so many causes of it, and we must recognize also the 3 phases that we have mentioned before.
Yes.
Then, if we are talking about, for example, the oral phases, it is the chewing of the food, where we are chew and we are making the food in pieces, we can have painful in the process of swallowing when we have any issue in the area of the oral cavity, including the teeth, including the gum, and including the tongue. Any inflammation, any issue in the mouth can be the first one of the commonest causes of difficulty in swallowing. While in the oropharynx, we have so many causes also associated with it. That can be inflammatory causes and can also be chronic causes. In the inflammatory causes, when we are mentioning the acute, that means less than 7 days, maybe less than 2 weeks with a difficulty in swallowing, can be usually associated with fever, can be also associated with malaria, and it is also associated, for example, with common cold. In anybody which is suffering for common cold, it's also reporting difficulty in swallowing because it's painful. The area of the oropharynx is inflamed. As being inflamed, then it's going to be difficult to swallow the food, passing the food through. But we must also consider another inflammatory cause, which is very common, especially in children. When the children are having chronicity, for example, in the Walderia ring, I mean tonsils. In the tonsils, more common, known by the population as tonsils, when the children are suffering from acute tonsillitis, they are also reporting, they can be reporting or they can be just refusing to eat because of the pain when it's passing through the oropharyngeal area. But in adult, we must recognize another causes which are very, very common. Is functional. The functional part of this process is including the nerve, are including the muscles, and then can be another cause, mainly in elder people. The elder population can be having a history of maybe a stroke, and then they can be reporting difficulty in swallow, secondary to a stroke, They can also be reporting, for example, that difficulty in swallow without any issue before, but it's just because they are entry in a phase of that. Doesn't mean that aging can be a cause of difficulty in swallow, Yes. It is not, definitely not. But some people are having issues with the muscles, can be related to a condition, chronic condition, and can also be another functional cause of dysphagia, of difficulty in swallowing. We have another phases which is very, very important, the esophageal phases. In the esophagus can be also appearing some common problem which are related mainly with peptic ulcer disease. The peptic ulcer disease is very common in our population. Then people must understand that whenever that difficulty in swallowing is taking time, they must look for help with ENT. Because can also be secondary to a peptic ulcer disease. It is very true. Can be just a reflex, but can also be a lesion. Lesion is meaning tumors. We have tumors in all of this area. Even in the oral cavity can be a tumor in the oropharyngeal part, and also can be a tumor in the esophagus. Then anybody which is suffering for difficulty in swallowing must understand when it is taken time, just look for help.
Ebigambo mubyewuliridde nga nange bwe mbiwulidde nankubadde nga ebisinga bya lusawo. Naye mu byonna dokita agamba nti ebisinga okuleeta obuzibu mu kumira bingi. Ebimu ffe tubyereetera. Ekyokulabirako agamba oyinza okuba nga wafunye okusabukasabuka mukamu. Nyina gwe mmanyi nga bw'agaayo ekikajjo oba emberenge zino hardcones mawogola gamusabula mu kamwa. N'ofuna akabwanga katono nnyo naye ne kafuula embeera okuba enzibu ennyo. Naga nti oyinza okufuna amabwa obanga olwadde ebibuno, era awo wonna okumira kufuuka okuzibu. Ekintu kyonna ekikwata mu kamwa kitwaliramu na okumira okufuuka okuzibu ennyo. Naye ayogedde ku nsonga y'okugaaya. Bannange, emmere tugigaaya naye tetugigonza. Emmere oluusi nga nkalu naye oli agaayamu katono. Omusawo omuyaŋŋa tulina okugaaya emirundi 3 naye abali ebifi by'ennyama ku nsani abange mugaaya emirundi emeka? Kaakati gwe n'ojja okimira ne kikkirira nga kiringa ekikukalabula kiriko n'obugumbagumba n'oga nti mpulira obuzibu mu kumira. Ebyo byonna by'ebizibu. Naye n'agamba nti omuntu ayinza okuba nga aluddewo ng'alwadde, ng'omuntu afunye stroke n'okulya nga talya. Kakati agenda okulya ng'emmere eringa eyita ewapya n'afuna obuzibu mu kumira. Oluusi n'emyaka nga gigenderedde oba emimiro gifunda, abakadde oluusi nti kiri common nnyo okufuna obuzibu mu kumira. Naye ensonga ya lusaazi, omuntu alwala lusaazi ne ziva eno mu lubuto ne zigenda zereeta amabwa okutuuka eno mu mumiro, n'osanga ng'okumira kufuuse kuzibu. Naye mu byonna ku Gombe Medical Services Hospital wano Professor ono Dokita ono waali mukugu nnyo mu kujjanjaba endwadde ez'ekiwanga, ate nga n'emmere kw'ogitadde oba osobola okufuna obujjanjabi. Ku BBS Terefayina kw'oli, naye nkujjukiza osobola okuweereza ekibuuzo kyo ku nnamba y'essimu eyo gy'olaba ku screen. Gombe Medical Services Hospital eri ku mikutu gyonna: Facebook, ku Twitter, Instagram, ku mutimbagano. Gombe Medical Services Hospital ku mikutu gyonna kweri. Weereza ekibuuzo kyo naddala ku WhatsApp ennamba eyo gy'olaba, n'emikutu egyo nga bw'ogiraba gyonna ojja kuboddibwamu. Mukkirize mpumulemu katono nnyo ate enkomawo. Oli ku BBS Terefayina, biri mu yematovu gegange omuweerezaawo. Kujjukiza bujjukiza nti buli lwa Sande Gombe Medical Services Hospital ebe kutuusaako obujjanjabi n'abasawo ab'enjawulo. Olunaku olwaleero ndi ne Professor, ndi ne Dr. Lydia Rosa omukugu mu ndwadde ez'ekiwanga, era atubuulira obuzibu obuli mu kumira. Mu bufunze tutunuulira ebizibu by'omumiro. Professor, you've talked about the signs and symptoms. Now a question comes. Are those symptoms and signs more common in children or adults? According to your clients who come at GMS here, commonly, what do you see in Uganda particularly?
In Uganda and in all around the world, it is difficulty in swallowing is something which is usually disturbing elder people. Not elderly, can be also be, of course, can also appear in a young population, but mainly in adult. Children are less worried about this, because we are always insisting in eating them as parents. We are insisting and we never ask if it is painful. That doesn't mean it's not an important point, But mainly children are in acute condition. When they are suffering for common cold, when they are suffering for acute tonsillitis, for example, they can say, it is painful, mommy, but it is not really so frequent to be having a long history of that difficulty in swallowing. While in adults, we must recognize that the age of our population is coming up, isn't it?
Yes.
Then we can be able to survive a cancer. We can be able to survive a stroke. We can be surviving a chronic disease. For example, hiatal hernia. We can be having a history of surgery in the area of the esophagus and in the area of the stomach. And this is a long history. Then, secondary to some procedures can also be associated to. The head and neck surgeries are also one of the common secondary causes of difficulty in swallowing, because we are manipulating a lot of the structures there which are involved in the normal process of swallowing, like muscles, like nerve. We are there. Then, whenever we are manipulating these areas, the patients secondary can be complaining of difficulty in swallowing.
Now, doctor, at times, how comes when one is chewing or eating and it gets a minor annoyance, swallowing becomes a problem? What is the problem there? When one gets annoyed?
The issue is,
yes, is it?
Whenever you are not paying attention to what is happening with your body, for example, you are chewing and you are always also maybe trying to be speaking.
Yes.
We have a structure which is very important. Our larynx is the vocal cord, the most important organ in our voice. Is having the vocal cord, and is also having a structure there which is separating our windpipe from our digestive tract, isn't it?
True.
Then whenever you get annoyed and you are just speaking with someone and you are also eating, your brain is not recognizing what is happening, and then the food can go down to the wrong pipe, and then it is also, but it is normal. It is happening in everybody.
Yes.
Can be happening, and then with a small amount of water, you are clearing your throat, and then it's passing through. It is also somehow is the way that we usually use to explain to our client what is difficult in swallowing. When this issue is happening for long, then we must pay attention. But when it is just accidentally, it's happening once in a time because you got annoyed, but
yes,
just a common thing.
Yes. Aliku BBS Terefayina, Dr. nga bw'abyogera bubiri. Naye kyenfunyemu nti ky'obalaba essaawa ey'okulya eba yakulya. Era osanga ebitongole ebimu oba abakozi abamu nga wabaawo break time. People to enjoy their lunch, to enjoy their breakfast. Era ky'ovola Abaganda wano baga nti bw'oba olya toyogera. Omusawo agamba nti okulya kuno nako kwetaaga okuwa obudde. Kyangu nnyo okufuna obuzibu mu kumira. Oli mu kulya, ogaaya, byogaaya bikaluba ate eno bw'owa ebiragiro, ekyo si kirungi. Kiyinza okuleeta obuzibu mu kumira. Naye n'agamba nti oluusi n'ebizibu ebimu bijjira mu kuwulira obulumi ng'omira. Oyinza okuba olwala endwadde ez'obukonziba. Ekyokulabirako omuntu nga yalwalako ku alusaaza azogeddeko, aniya n'ebirala. Naye mu byonna bw'oba otuuse okulya, emmere giwa obudde, obwongo bubeere ku ekyo, osobole okugaaya ekimala, omire emmere ng'omaze ogimerengula. Oli ku BBS Terefayina. ffe wano buli lwa Sunday tubeerawo Gombe Medical Services Hospital buli lwa Sunday essaawa 12:30 ku BBS Terefayina byabulamu n'abakugu mu kunoonyereza ate era n'okujjanjaba. Doctor, how is this diagnosed?
The diagnosis of the assessment of difficulty in swallowing is starting for sure with a good exam and history taken. We are going to start taking a history with our client and also with a relative of them to tell us what is the issue, how it is starting to happen. After good history taken, we are going to make an ENT exam in the area of our ear, nose, and throat, of course. And it is also including an exam which is called endoscopy. We shall start with an endoscopy in the hypopharynx. It is called pharyngolaryngoscopy, and it's upper airway endoscopy. And we can also perform and we can also request for some diagnostic tests. Most important diagnostic test is a esophagogram. Esophagogram is also known as barium swallow. That barium swallow is going to get is an X-ray which is done after swallowing barium milk, and then we took an X-ray. With that X-ray, we can recognize if the area is having any strictures or any other associated changes, and can go, you can, it's just to get an idea if it is necessary to go to the upper endoscopy. Upper endoscopy is also known as esophago-stomach and duodenoscopy. This is going to give us a better idea to recognize if there is an esophagitis, if there is a esophageal cancer maybe, or peptic ulcer disease, if we are on the presence of hiatal hernia, or any other between many causes of this in the lower part of our swallowing.
Yes. As we continue, so the results calls for the treatment. The findings calls for particular treatment.
When we get a definitely diagnosis, then we shall start with the treatment. And the treatment is including, of course, medications, but it's also going to be including lifestyles and changes. In the lifestyle changes, we are going to include some feeding changes. You know, people are going to know what are the foods who can be continue using, what kind of foods they must avoid, because there are so many different kind of food, and we can afford. Maybe chili is going to be out of your diet at the end of the day.
Yes.
But you must also recognize that the position of how you eat is also important. To be eating in an upright position, it's going to guarantee that you are going to have a good digestion. Some people likes to eat in the bed, and then we must teach to our children, please, the bed is not a place. Because of that, we must have education about.
Yes, ebigambo bingi naye mu byonna ekizibu ekiba kizze ye ng'omukugu mu ddwaliro wano bakukebera, basobola okukebera nga bakozesa scan, bayina n'akuuma kayina akatooki kakubayo ako kayisa endoscopy n'ebigenderako anti bya lusawo bannange, naye byonna biri ku Gombe Medical Services Hospital. Era ne bazuula agambye nti basobola n'okuwa ekyokulya ng'oli ku sikaani, ntegeeza ka TV n'okimira ne balaba bwe kitambula ne balaba bwe kituuka bwe weekangamu ne bamanya nti awo wali obuzibu. Ebyo byonna busobola obbikola. Naye mu byonna ebiva mu ebyo oyinza okusanga emmere emu bagikuggyeeko. Oyinza okuba munaye obadde olya nnyo kaamulali nga yavaako obuzibu ne baga nti kaamulali ogira omuleka. Oluusi nga n'engeri gy'olyamu olya bubi, oliira mu buliri nga weebase bannange. Ebyo byonna basobola obbikuggyako oba n'entuulo otudde otya ng'olya kyovula n'entebe za dining zirina bwe zaakula olina kubanga otudde bulungi okusobola okukola ki okulya n'ebirala ebifaanako bwe bityo naye nga mu byonna Gombe Medical Services Hospital abakugu ebalina nankubadde ne mu Uganda yonna ewala gye bali tofuna buzibu n'otajja anti akuwagoowa. Professors wind up as we end the program in less than a minute. What is your take? What is your advice to the viewers?
Our advice is always about to understand if you are suffering for a long time for any symptoms, please, you look for help. You look for help. Don't keep with it with you only. You need to share with relatives, and then the relative, of course, are going to tell you how to look for help. ENT surgeons, we are able to start the assessment of any kind of difficulty in swallowing. You please come and we are going to guide you. Thank you all.
Weewaawo kakati agamba nti bannange bw'ofuna ekitali kya bulijjo mu mubiri gwo bw'okiwulira ne bw'okiraba kigabaneko n'abakuliraanye ne bata abasawo nga tonnagenda kulaba basawo naye era dduka olaba abasawo yonna mu Uganda abasawo mwebali wano ku Gombe Medical Services Hospital abasawo mwebali naye totuula ku obulwadde balanga bulangi bw'osirika obulwadde tebufuna ddagala omusawo kyagamba naye nga abakugu ku GMS webale nnyo okwekumira ku BBS Terefayina oyina ekibuuzo enamba y'essimu eyo giraba ya WhatsApp eyo weerezaako ekibuuzo kyo kale gikube weebuuze genda ku mikutu gyaffe gyonna Gombe Medical Services Hospital ku mutimbagano gwenyigamu GMS Gombe Medical Services Hospital ojja kubanga otufuna buli lwa Sunday essaawa 12:30 ku BBS Terefayina nange musajja wa Kabaka abiri mu Yematovu Gombe Medical Services Hospital ku Balitumwa Road Bujjanjabi. Kwagaliza akaseera kalungi Katonda kuume Ssaabasajja Kabaka awa